Welcome back to the MT Spot's Blood Pressure Podcast. I'm Samuel Harrison, and as always, I'm excited to be here today, ready to dive into a topic that's, well, it's really pretty crucial for understanding, heart health calcium channel blockers.
And I'm Olivia Harper, happy to be here. I'm ready to sort of unpack the science behind these medications and why they're such a valuable tool, really, for managing various cardiovascular conditions. It's interesting.
Okay, so let's just jump right in. These calcium channel blockers, I've also heard them called calcium antagonists, kind of sound like they're blocking something important. What's the deal with calcium in our bodies anyway?
Well, it's fascinating, actually. You can think of calcium as a messenger. It kind of tells your muscles to contract. And this is especially important for your heart and your blood vessels, where muscle contractions control your heartbeat and blood pressure.
So if calcium is like the go signal,
Yeah.
then are these calcium channel blockers like hitting the pause button?
Exactly. They're like little gatekeepers. They sit right at the entrance of the muscle cells, limiting the amount of calcium that can get in. And that helps the muscles to relax. And that leads to wider blood vessels and reduced strain on the heart, less pressure.
Okay, that makes sense. So less squeezing, better flow, happier heart. Makes sense to me.
Yeah.
Now, I'm seeing that these calcium channel blockers are prescribed for a bunch of different conditions. It's not just high blood pressure. What else are they used for?
Well, you've got angina, which is that chest pain that's caused by reduced blood flow to the heart. And so by relaxing the blood vessels, the medication increases the blood flow and the oxygen supply to the heart muscle, and that leaves the pain.
So it's like clearing a traffic jam in the arteries. Let everything move a little more freely.
Yeah, exactly. And then you have arrhythmias, which are irregular heartbeats. Some types of calcium channel blockers, they can actually regulate those rhythms. It's like a conductor for your heart's orchestra. They keep the beat nice and steady.
That's a great analogy. So I'm guessing they're also helpful for Raynaud's disease, where the blood vessels in like the fingers and toes, they constrict, right?
You got it. So by relaxing those constricted vessels, they improve the blood flow to those extremities, and it reduces that numbness and coldness people experience.
Wow. So these calcium channel blockers are like multi-talented. They're like superheroes tackling all these different cardiovascular challenges. But what makes them stand out from other medications? Why would a doctor choose them over other options?
Well, one of the things that makes them so remarkable is just how versatile they are. They have a broader spectrum of activity compared to some other drug classes. It's like having a Swiss Army knife of cardiovascular meds. They're effective for multiple conditions, especially for patients who are juggling several health issues at the same time.
Oh, so it's like a real one-stop shop for heart health.
Yeah, exactly.
I like that. Now, I've also heard that they're particularly effective for certain groups like older adults and people of African descent. Why is that?
Yeah, that's an important point. There's ongoing research into exactly why that is. It could be because of differences in how different populations metabolize medications. There also might be variations in blood vessel structure and function, or even differences in how they respond to other treatment options.
So it's all about recognizing that the treatment isn't one size fits all. It's about finding the right approach for each individual, right?
Exactly.
Now, I know that there are different types of calcium channel blockers. What are the main categories and what makes them unique?
So there are two main classes. You have dihydropyridines and non-dihydropyridines. They're like two branches of the same family, but each has its own personality and its own skill set.
Okay, so let's start with the dihydropyridines. What's their area of expertise?
Well, think about your arteries like highways.
Mhm.
Dihydropyridines are the traffic controllers. They specifically target the smooth muscle cells that line the arterial walls. They tell them to relax and just let more blood flow through. So that makes them particularly good at lowering blood pressure.
So they're like the chill pills of the calcium channel blocker world,
Yeah,
easing that tension, keeping things moving smoothly.
that's right.
All right, so what about the non-dihydropyridines? How do they differ?
Yeah, this branch it's a bit more multifaceted. They affect both the heart muscle cells and the muscle cells in the arteries. So they're not only relaxing the blood vessels, but they're also influencing the heart rhythm.
So they're like those talented people who can juggle like multiple tasks with ease.
Yeah, that's a great way to put it.
So what kind of conditions do they typically handle?
They're kind of the go-to for a wider range of issues, high blood pressure, heart rate abnormalities like atrial fibrillation and angina. And within this group, you have subcategories. So you have the phenylkylamines, verapamil is a well-known example, and then the benzodiazepines, where diltiazem takes center stage.
So it's like a family tree. You've got the dihydropyridines, the specialists in relaxation, and then the non-dihydropyridines branching out to tackle both the blood vessels
Yeah.
and the heart rhythms. It's fascinating how those subtle differences in their actions, lead to such specific uses.
It really is. And it highlights why it's so important to work closely with your doctor to figure out which type of calcium channel blocker is, the best fit for you. It's about individual needs.
Yeah. Well, speaking of individual needs, we kind of have to address the elephant in the room, side effects. Are there any that we should be aware of with these?
Of course, like any medication, there can be side effects. But the good news is they're often mild and temporary.
Okay. Well, that's reassuring. What are some of the most common ones? Is there anything major to worry about?
The usual suspects, you've got dizziness, flushing, headaches. Some people experience swelling, maybe some constipation, palpitations, fatigue, those sorts of things.
Okay, so mostly things that sound manageable, nothing too alarming. But are there any rare but more serious side effects that we should be aware of?
Yeah, while much less common, it's important to know that there are some potentially serious side effects like, shortness of breath, severe abdominal pain, or severe dizziness that can lead to fainting. And, if you experience any of those, definitely contact your doctor right away.
That makes sense. It's all about being aware and proactive. So now, what about drug interactions? Are there medications that just don't play well with calcium channel blockers?
That's a crucial question. So yeah, these medications can interact with other drugs, and that can impact their effectiveness or increase the risk of side effects. A big one is beta blockers, another type of heart medication.
Okay, so why is that combination a potential problem?
Well, if you're taking both, especially the non-dihydropyridine calcium channel blockers like verapamil or diltiazem, it can increase the risk of a slow heart rate, something that we call bradycardia, and potentially other heart problems.
So that's definitely a no-no without some careful medical supervision. Are there any other interactions we should be aware of?
Another one to watch out for is with statins. Those are the cholesterol-lowering medications. Calcium channel blockers, they can actually increase statin levels in the body, and that could lead to some, unwanted side effects like muscle pain.
Okay, so it's all about balance and careful monitoring.
Hmm.
What about something as seemingly harmless as grapefruit juice? I've heard that can be an issue with certain medications.
You've heard right. Ever wonder why doctors warn about grapefruit juice and certain medications? It's pretty fascinating. Grapefruit contains these compounds that interfere with the enzymes that are responsible for breaking down certain drugs in your body.
So you end up with a higher concentration of the drug in your system than intended.
Exactly. So in the case of some calcium channel blockers, that can lead to stronger side effects. You're essentially getting a higher dose.
Wow. That's definitely something to keep in mind. Are there any other medications that interact with calcium channel blockers?
Yes. Antiarrhythmic drugs, which are used to treat those irregular heartbeats, they can also interact with calcium channel blockers, and that can enhance the blood pressure lowering effect, but it can also, increase that risk of the slow heart rate that we talked about. And then we also need to mention certain HIV drugs and cyclosporine, which is an immunosuppressant medication. Those can interact with calcium channel blockers and potentially increase the risk of side effects.
So the takeaway here is clear. Communication is key. Always tell your doctor about all the medications and supplements you're taking to avoid any unwanted surprises.
Yeah, always better to be safe than sorry. Just have that open dialogue with your healthcare provider. Now, let's move on to how to use these medications safely and effectively.
Sounds good. So we know they come in pill form, but is there anything specific we should know about taking them?
Well, the golden rule is always follow your doctor's instructions. Take the medication exactly as prescribed. Don't change the dose and don't stop taking it abruptly without talking to your doctor. Consistency is really key here.
Okay, so no self-medicating or going rogue with the dosage.
Right.
What about timing? Does it matter when you take them?
Try to take it at the same time each day. This helps maintain a steady level of the medication in your system, and it just makes it easier to remember. Some calcium channel blockers, they should be taken with meals, to prevent side effects like dizziness or feeling faint. And then others can be taken without regard to meals.
So again, it's all about those personalized instructions from your doctor.
Yeah.
What about if you're prescribed a sustained release form? Anything special about taking those?
Yeah, just make sure to swallow it whole. Don't crush, don't chew, don't break it. It's designed to release the medication gradually over time.
Got it. No DIY modifications to the pills.
Right.
What happens if what happens if you miss a dose?
Well, don't panic. Just take it as soon as you remember. But if it's close to your next scheduled dose, then skip the missed one and continue with your regular schedule. Never double up to catch up. And remember, regular follow-ups with your doctor are really essential. It helps to monitor your progress, adjust the dosage if needed, and address any concerns or side effects that you might be experiencing.
So it sounds like it's all about being consistent, communicating openly with your doctor and just being aware of those potential interactions.
Yeah, you've summed it up perfectly. It's really a partnership between you and your healthcare provider to manage your health effectively.
Well, this has been incredibly insightful. I think we've covered a lot of ground on calcium channel blockers,
Yeah.
from how they work and their benefits to potential side effects and drug interactions.
Yeah, it's clear that these medications play a vital role in managing a whole range of cardiovascular conditions, and with the right medical guidance, they can be a really safe and effective treatment option.
Absolutely. But before we wrap up this part of our deep dive, we have one more crucial point to emphasize.
What's that?
This is so important. Never, ever start, stop, or change the dosage of a calcium channel blocker without consulting your doctor.
That's right. It's not a DIY project. These medications can really impact your heart rate, your blood pressure, your overall cardiovascular health. Your doctor really needs to be involved every step of the way. They're going to take into account your individual health history, your current conditions, other medications you're taking, a whole host of factors to figure out the best course of treatment for you.
Yeah, it's all about personalized care and a collaborative approach.
Absolutely. Remember, abrupt changes to your medication can have some, unintended consequences. So always talk to your doctor first. They're there to guide you and ensure your safety and well-being.
We'll be back soon with part 2 of this deep dive on calcium channel blockers. Stay tuned.
Welcome back to the TheEMTSpot's Blood Pressure Podcast. It's great to have you back. We're going to continue our deep dive into this world of calcium channel blockers.
That's right. And in this part, we're going to shift gears a little bit. We're going to focus on what you, the listener, can do to take charge of your health journey, when it comes to these medications.
Yeah, absolutely. So understanding your own individual needs, and your risk factors is a crucial first step. That means having open and honest conversations with your doctor. Talk about your medical history, your lifestyle, any concerns you have.
So it's about being an active participant in your healthcare, not just a passive recipient.
Precisely. It's a partnership. And knowledge is power, right? The more you know about calcium channel blockers, the potential benefits, the risks, the better equipped you'll be to make those informed decisions.
And we've definitely laid a strong foundation of knowledge in that first part of our deep dive.
Yeah, indeed we have. Now remember, it's not just about taking the medication, it's about adopting that holistic approach to your heart health.
Yeah, so it's about incorporating those healthy lifestyle habits we hear so much about.
Exactly. And they really do make a difference. Think of it like this. Your medication is like a skilled mechanic working on your car's engine. But those healthy habits, they're like providing your car with the best high-quality fuel and doing regular maintenance. Things like a balanced diet, regular exercise, managing your stress, avoiding things like smoking. They all play a part.
That's a great analogy. So it's about optimizing your overall health, not just relying on the medication to do all the heavy lifting.
Exactly. So once you're actually on a calcium channel blocker, how do you know if it's actually working? How do you monitor your progress?
That's a great question. It's like embarking on a road trip. You got to check the map every now and then and make sure you're heading in the right direction.
I love that analogy. And one of the most important things you can do is keep a close eye on your blood pressure.
So we're talking about investing in a home blood pressure monitor that's reliable, tracking your readings regularly.
Absolutely. Think of it like taking your heart's pulse. By tracking those numbers, you and your doctor can see how well that medication is working, and then make any adjustments if needed.
And that really empowers people to take a more active role in managing their health.
Precisely. Another crucial aspect of monitoring your progress is paying attention to any side effects that you might be experiencing.
Yeah, we did touch on this earlier, but it's worth reiterating. Even if a side effect seems small or insignificant, it's still important to report it to your doctor, right?
Absolutely. You're right. No matter how small it might seem, that early detection and open communication, it's key. Remember, your doctor is really your partner in this journey.
It's like having a co-pilot who can help you navigate any of the turbulence you might encounter along the way.
That's a perfect way to put it. And, finally remember that no question is too small or too silly when it comes to your health. Don't be afraid to ask your healthcare team anything you're unsure about.
So it's all about that open dialogue, being an active participant, and just that commitment to those healthy habits.
You got it. Taking charge of your health journey, it's an ongoing process, and we're here to empower you every step of the way. We'll be back soon with the third and final part of our deep dive on calcium channel blockers.
Welcome back to the Empty Spots Blood Pressure Podcast. We're here for the final part of our deep dive into calcium channel blockers.
It really has been an incredible journey, hasn't it? We've been exploring these medications, talking about the benefits, the potential risks, and how you, the listener, can really take an active role in managing your heart health.
Absolutely. We've covered so much ground, from like the cellular level to those big picture lifestyle changes that make such a difference.
And as we wrap up this deep dive, I want to leave you with a thought that has really been resonating with me throughout our conversation.
Okay, I'm all ears. What's this pearl of wisdom?
It's the power of knowledge. The more we understand about our bodies, about these conditions and about the medications that we're taking, the less scary it all becomes.
That's so true. Knowledge really does replace that fear with confidence.
Exactly. When we understand how things work, we feel more in control. We can have those informed conversations with our doctors, advocate for our own needs, and really make choices that align with our health goals.
It's like having a roadmap instead of, wandering through some unfamiliar territory blindly.
I love that analogy. And remember, you're not alone on this journey. You have your healthcare providers, your support network, and resources like this podcast. We're all here to help guide you and empower you.
Well said. This has been such an insightful and empowering exploration of calcium channel blockers. We really delved into the science, the practicalities, and that importance of taking an active role in your health.
It's been a pleasure sharing this journey with you and with all our listeners.
A huge thank you to everyone who tuned in to the MT Spots Blood Pressure Podcast. I'm Samuel Harrison.
And I'm Olivia Harper.
We're here to support you on your path to better heart health. And if you found this deep dive helpful, be sure to subscribe, like, comment, and share it with anyone else you think might find it useful. Let's spread the knowledge and empower each other to really take charge of our well-being. Until next time, stay heart healthy.